talk about the guidelines for the prevention of VTE in Latin America. And I would like to invite Anaya, Malvika, and Romika to give their research presentation and interpretation of the ASH guidelines.
Good afternoon. My name is Malvika, and along with my colleagues, Anaya and Romika, we're here to present our research on the American Society of Hematology, or ASH's guidelines for prevention of venous thromboembolism, VTE, in Latin America. Now here's our abstract. Please take a moment to read it. Now, as we have the privilege of making this presentation in Porto Alegre, which is a part of Latin America, we decided to research on this specific topic. It's important to note that there are separate guidelines for the Hispanic population. Now, between 2017 and 2020, ASH sought recommendations specific to patient populations in Latin America, and they partnered with 12 societies to adapt the VTE clinical practice guidelines. Now, why focus on Latin America? Well, compared to the multiple studies that evaluated the epidemiology of VTE in European and American population, there's limited evidence on the prevalence of VTE in Latin America. Now, also evidence from studies in the US suggests that race does actually play quite a differentiating role in the incidence of VTE. In addition, there are various regional challenges to effectively diagnose the risk of VTE and provide appropriate prophylaxis. Now, this also includes treating VTE patients with appropriate anticoagulation. Now, are the ASH guidelines acceptable to the societies in Latin America? Here's a table which states the 12 societies that ASH partnered with to develop the VTE guidelines that are specific to Latin America. Now here's a chart that displays all the countries, or the home countries, of the authors that these guidelines are made from. Now you can see that in this chart, a majority of the authors' home countries are based in the Latin American region. Now here is the 6-step process that we used to create the guidelines to make sure that they were appropriate and accurate. The first step was that each society nominated one individual to serve on the guideline panel. The second step was that the work of the panel was facilitated by 2 methodologists. The third step was that the team selected 4 of the original VTE guidelines for a first round of evaluation. The fourth step was that to make sure that the most relevant guidelines were selected and the most relevant questions were introduced in this discussion, an online survey was first conducted, followed by an in-person meeting. So that included a 2-step prioritization process. Now, the 5th step was when the in-person meeting was conducted, where the panel developed these guidelines using the adult med process. And the final step was that the evidence about the health effects from the original guidelines were reused to now create the guidelines that are specific to the Latin American population. And this included resource use, accessibility, feasibility, and the impact on health equity, which were all added to create the guidelines for the Latin American population. Now, the adaptation of the VTE guidelines covered 2 specific topics. One is the prevention of VTE, which included the prophylaxis in medical and surgical patients, as well as long-distance travelers, and then the management of VTE, which is about the treatment and anticoagulation therapy. Thank you. Now I'd like to give it off to my colleague Anaya.